Over my career, I've worked with hundreds of adolescents, many of whom have substance use disorders. My name is Bill Hudenko. I'm a licensed psychologist and a professor of psychological brain sciences at Dartmouth. And I have a very strong commitment and investment to helping parents and teens figure out this problem. You must have that channel of communication open.
By bringing other people into that process, it broke that feeling of being alone.
More like, oh, we're talking about drugs and alcohol because I'm a teen and I might encounter that.
When we think about the problem of teen or adolescent substance use, it's really on a continuum, where on one end is recreational use, and on the other extreme is dependence. Somewhere in the middle is what we might think of as misuse of the substance. So it's actually quite difficult to know exactly when someone crosses over that threshold into misuse and then beyond to the state of dependence. So generally, when I talk with parents and when I advise people on how to look for signs, we like to think a lot about some of the things that are signs of misuse, because that's when things start to get really scary. And I say scary because if someone gets past that point to dependence, it's really problematic. And in part because there's often very little we can do for a population of people to really help them get better. So we always want to work very hard on knowing the signs, focusing on misuse and understanding. So some of the things we look for are, one, we really think about when has the individual gotten to a point where it's impacting their life negatively, and where they're starting to say or do things that indicate it's a focus of their mind. So they might be talking about it a lot, they might be looking at websites, they might be really thinking a lot about how to get access to substances or when they might get their next fix of whatever that substance is. We also look for things like what's the motivation of the individual. So if the person is doing it in a social way where it might be with friends or at a party and it's occasional, it's a little bit less concerning than if the motivation is to, let's say, reduce a strong negative emotion that they have, so that then it becomes more likely to move toward dependence. And then, of course, we're very concerned if there's things like involvement with the law, if there's problems with relationships, or if any way it's really causing them a lot of distress or self or other harm. So these are all things that are really concerning to us. One of the things that we see is when adolescents really get involved with substances, we can see a decline in a number of different areas. So for example, if we're seeing that there's a decline in schoolwork, a difficulty with concentration or focus, a pull away from other activities that previously they found engaging, those are also additional signs that we are concerned about. When we think about that transition from misuse to dependence, there's three factors that we're often looking for. The first factor is the duration of use, the second is the amount, and the third is the frequency of use. So with those three factors, the duration is how long has someone used substances? Did they start when they were very young? Has it only been a month? Has it been 3 years? The frequency is, are they using substances once a day, twice a day, 5 times a week? What's the frequency? And then how much are they consuming when they do it? And depending upon the substance that is being used, some substances allow for example, more duration or more amount without as many negative effects. Other substances, that is not the case. And a good example would actually be nicotine. So many people don't know that nicotine is one of the most addictive drugs on the planet that is very commonly used. And even with a very small amount of nicotine, the chances of someone getting to dependence is quite high. So one such motivation might be a mental disorder such as depression. That is because when someone is in a depressed state, if they are also using substances, it might end up with that individual trying to escape a negative emotion. And that type of escapism is very dangerous because it can lead to dependent type behavior that then takes over and makes the depression much worse. So it doesn't exclusively have to be depression. It can be a number of different mental illnesses or even just an individual's tendency toward avoidance that we are concerned with. And that type of motivation is one that you should look for and hopefully get treatment for the other thing to make sure that the person is dealing with those problems head on. When I speak with parents, one thing that I like to also ask is about the history, the family history use of substances and potentially substance use disorders in the family. The reason for that is because we do know that people who have a genetic predisposition towards substances and substance use and the development of substance use disorders are likely to carry that. And therefore, it is something that you need to be aware of and ask other family members about, because if your family has it in your family tree, it might be more likely that, for example, that your child may be predisposed to a substance use disorder. I am no stranger to adolescents who don't want to come into treatment. And one of the things that I often tell parents is the most important thing is the first step to get the person help. And I think that first step is really around assessment by a professional, hopefully, who has some awareness of when someone might have crossed that line into misuse and then towards dependence. So what I often tell parents is do what you can to get your adolescent to just agree to talk to someone who is not you. And frankly, oftentimes they're happy to do that, to speak with someone who's not you about what could be a problem. Say things like, I just want to make sure that you're okay. How about you talk to somebody else who knows more about this than I do? Let's just be sure that you're safe. These are kind of statements that make it seem that you really care, which you do, and that you want to have somebody else just check in with them. And that can lead you on a much better path. I've actually encountered a lot of adolescents who worry about the social ramifications of not being able to drink or not being able to go to a party where there are substances. And it's so important for them to know that, yes, there might be social pressures, but it goes along with this theme and this important concept of talking with your kids. You must have that channel of communication open so that they can trust you and then you can trust them.